Bismillahirrahmanirrahim. Today we will again discuss the topic cerebrum. Last week we have discussed cerebrum in part 1. Now today again we discuss from the start and we will complete it today. First we see the objectives. Here we describe the general structure of the cerebrum and cerebral cortex and identify the cerebrum, lobes of cerebrum, cerebral cortex, and its main regions or divisions. Then we see the 6 layers of the cortex and main feature of each cortex, each layer of the cortex. Then we see the major functional areas of the cerebral cortex. Here we see what is brain. It is part of central nervous system, as we have already discussed, but we consider the cerebrum, which consists of 2 cerebral hemispheres. And these are the features of the brain as a whole. Its weight in normal adult is 1400 gram. It's by the meninges, and also it is surrounded by CSF. This is the picture of the brain with spinal cord. Here different parts are shown. This is cerebral hemisphere, and this part is green is the midbrain, pons and medulla, that is brain stem, and this is the cerebellum. These are all surfaces of the brain. This is superior surface, lateral surface. This is also lateral surface. And this is medial view of the left side of the brain. Here we see that the 2 cerebral hemispheres, they are separated by the fold of dura mater. Here lies fold of dura mater, that is called falx cerebri or cerebral falx. This is a longitudinal cerebral fissure in which this falx cerebri lodges. In this picture we can also see this is cerebrum. Here again we see that it is a large part of the brain, and these 2 cerebral hemispheres are connected together by a group of fibers which are called Commissural fibers, and this structure is called corpus callosum. We see that each cerebral hemisphere is folded, and it has gray and white matter. Gray matter is outside, and on the inside is the white matter, which is medulla. And it also contains lateral ventricles, which are continuous with the 3rd ventricle to the interventricular foramen. Here we can see in the section, this is coronal section. Outside is gray matter, it is cortex, and this is medulla, the inner portion, which is white matter. And it is opposite to the spinal cord, in which gray matter is inside and the white matter is outside. Now we see the cerebral surfaces. Surfaces of the cerebral hemisphere. These are 3 surfaces: superolateral surface, medial surface, and inferior surface. Here we see that inferior surface is further divided into 2 parts. One is orbital surface and other is tentorial surface. These are the pictures showing different surfaces. This is superolateral surface and this is medial surface. And if we see the inferior surface, it is further divided into 2 parts. It is orbital, anteriorly, and posteriorly, the tentorial surface. Superolateral surface follows the concavity of the cranial vault. Medial surface is vertical, flat, And the two medial surfaces of the two cerebral hemispheres, they are separated by the falx cerebri. Inferior surface or basal surface, which is irregular, and we have seen in the picture, it is divided into two parts, orbital and tentorial. Now we come to the lobes of the cerebral hemisphere. There are four main lobes, but if we consider the all lobes, it will be 6 lobes of the cerebral hemisphere: frontal lobe, parietal, temporal, occipital, and the two other lobes are insular lobes and the limbic lobe. This picture shows the insula, and this picture shows limbic lobe. It is above the corpus callosum. Here is the limbic lobe. And this is occipital lobe, this is parietal, frontal, and this is temporal. Different colors. Anteriorly, this whole is the frontal lobe. And if you see the inferiorly, it is temporal. The central sulcus, this is the central sulcus. It separates the frontal and parietal lobes. And this, if you trace this sulcus, it meets with the lateral sulcus. So we consider the lateral sulcus, it separates the temporal inferiorly from the superiorly two lobes, frontal and parietal. Here is the occipital lobe, which is separated from the parietal and temporal by parieto-occipital sulcus. This is skull. Frontal lobe lies in the anterior cranial fossa. Temporal lobe lies in, this is middle cranial fossa, and lateral parts occupy the temporal. And occipital lobe of the cerebral hemispheres, they lie in the posterior cranial fossa above the cerebellar tentorium or tentorium cerebelli. Below this tentorium cerebelli is the cerebellum. Now we see the poles of the cerebral hemispheres. There are 3 poles. Anterior-most point, which projects anteriorly, and these 2 lobes, frontal and temporal, they project anteriorly. The anterior-most point is the frontal pole, and the part of the temporal lobe which projects anteriorly is temporal pole, and this part was this lobe was the occipital lobe, and the most posteriorly projecting part is called occipital pole. So there are 3 poles: frontal, temporal, and occipital. If you see the borders of the cerebral hemisphere, there are 2 borders. This is supromedial border, and this is the inferior border. Now we see the sulci and gyri. There is folds in the cerebral cortex. You can see the raised area, which is gyrus, and depressed area is the sulcus. So this convoluted structure increases the cortical volume 3 times, and the total area of the cerebral cortex becomes 2200 centimeters squares. Now we see the main sulci and gyri. Central sulcus, this is central sulcus. This is the boundary between frontal and parietal lobes, and it starts the supromedial border. This is supromedial border. It starts from, and little behind the midpoint between frontal and occipital. It goes downward and forward and ends above the posterior ramus of the lateral sulcus. Here is the lateral sulcus, and it has 3 rami or 3 branches. This is posterior ramus, this is ascending ramus, and this is the anterior. Which is called anterior horizontal This is anterior ascending. Lateral sulcus, deep cleft on the lateral and inferior surface, and we have seen that it has a stem which divides into 3 rami: anterior, ascending, and posterior. Here we again see that is ascending ramus, this is anterior ramus, and this is posterior ramus. Other known sulci: superior frontal sulcus, inferior frontal sulcus, precentral and postcentral sulcus. This is central sulcus. Anterior to this is the precentral sulcus. This is precentral sulcus, and this is postcentral sulcus. And here we see superior frontal sulcus and then inferior frontal sulcus. Now we see the medial surface of the cerebral hemisphere. If you see there, here is the corpus callosum. This is the bundle of fibers, and this type of bundle of fibers are commisural fibers, which connect the two cerebral the same parts of the two cerebral hemispheres with each other, and it lies in the depth of longitudinal fissure, this corpus callosum. And it has 4 parts: rostrum, this is rostrum anteriorly, then come genu, this bend is called genu, then body or trunk, then posteriorly the splenium of the corpus callosum. Here picture we can also see again different parts of the corpus callosum: rostrum, genu, body, and splenium. This picture also shows medial surface and different sulci. Here is the calcaneum sulcus posteriorly. This is parieto-occipital sulcus. This is cingulate sulcus, and this below this cingulate gyrus, and below the cingulate gyrus is the corpus callosum. Here is collateral sulcus. The posterior region of the medial surface is traversed by parieto-occipital and calcarine sulcus. We already discussed the parieto-occipital sulcus. It marks the boundary between parietal and occipital lobes. The visual cortex lies above and below the calcarine sulcus. In the inferior surface, we see olfactory sulcus, rhinal sulcus, occipito-temporal sulcus, and collateral sulcus. These 4 sulci are visible on the inferior surface of the cerebral hemispheres. Now, this lobe, insular lobe, which is present within the lateral sulcus between temporal and frontal lobes. This is frontal and this is temporal. And the overlying cortical areas are called opercula, which are found from the parts of frontal, temporal, and parietal lobes. Its function is linked to the emotion and body's homeostasis, that is perception, motor control, self-awareness, cognitive function, and interpersonal experience. Here we can again see the cerebral cortex. You see the histology of the cerebral cortex. It contains nerve cells, nerve fibers, neuroglia, and blood vessels. And macroscopically, the cortex, which is outer gray matter, it consists of 6 layers or 6 laminae, which are parallel to the surface of the cerebral hemisphere. Now we see 6 layers from outside to inside. First is the molecular layer, we already discussed in the previous lecture. Then is the granular layer. Third is the external pyramidal, then internal granular and internal pyramidal, which is also called ganglionic layer. And the last one is the deepest layer, is the multiform layer or layer of polymorphic cells. So the different types of cells and fibers, they are discussed in the previous lecture, which contains each of this layer. Important thing is that this fifth layer, internal pyramidal layer, it contains large size of pyramidal cells, which are called bed cells, and it gives rise to corticobulbar, corticospinal, and corticostriatal fibers. They all arising from the cortex and go to the different parts of the brain and spinal cord. Now we see the different cells. Now pyramidal cells have large apical dendrites. These are the apical dendrites. Axons, this is axon, projects downward into the subcortical white matter. This is present in the gray matter. We have already discussed the 6 layers. The axon go into the deeper part, that is white matter of the cerebral hemisphere. And this pyramidal cell is the primary output neuron. This picture also shows the pyramidal cell, and this is the stellate cells, the star-shaped cell. This is cerebral hemisphere showing different gyri and sulci from the superior view. Then this is from the lateral view of the right cerebral hemisphere. This is medial view of the right cerebral hemisphere showing different sulci and gyri. And this is the picture of lateral right cerebral hemisphere, lateral side and dissected side, and we can see that insula which is buried inside. This is the inferior view, the brain, showing the 2 cerebral hemisphere and other parts of the brain. Now we see the cortical areas. These are different areas, specialized areas. There are 47 cyto-architectural areas, are called Brodmann areas, and they have specific numbers and there are specific functions. Motor areas, if we see motor areas, then the first one is the primary motor cortex, or area 4. This is area 4, or primary motor cortex, which is located in the pre-central gyrus. This is central sulcus, and anterior to this sulcus, the gyrus is pre-central gyrus. Posteriorly is the central gyrus. We see pre-central gyrus, area 4. It contributes to the tract corticospinal, main tract, descending tract, and it contains joint cells of beds in the layer 5. If we stimulate this area, then it will result in the contralateral movement of the voluntary muscles, especially of the distal muscle of the limbs. And if we surgically remove the part of this area, then it will result in the contralateral upper motor neuron lesion. So here we can see that these all effects are on the contralateral side of the body. Second is the premotor cortex, or area 6. This is premotor cortex, area 6, which look at anterior to the precentral gyrus, and it also contributes to the corticospinal tract and plays a role in control of proximal and axial muscles. Next is supplementary motor cortex, area 6. This is supplementary motor cortex. Located in the medial surface of the cerebral hemisphere, anterior to the paracentral lobule, it contributes to corticospinal tract. Its role is in the programming complex motor sequences and in coordinating the bilateral movements. Next is the frontal eye field, area 8. Here is the area 8 in the posterior part of the middle frontal gyrus, and it projects via the corticotectobulbar tract to the contralateral lateral gaze center of the pons, that is abducens nucleus. If you stimulate this area, it results in conjugate deviation of the eyes to the opposite side. And if destroyed this pod, it will result in the conjugate deviation of the eyes toward the side of lesion. Next are the higher cortical functions. Prefrontal cortex, area 9 to 12. This is prefrontal cortex. Here we see that frontal lobe syndrome. It results from lesion of the prefrontal cortex, and the signs will be inappropriate social behavior, difficulty in adaptation, and loss of initiative, gait apraxia, incontinence, or abulia, loss of ability to perform voluntary actions. Now we see the Broca speech area, area 45, 44 and 45, they are located in the posterior part of the inferior frontal gyrus, and inferior frontal gyrus of the dominant hemisphere, that is left hemisphere. And it is connected with the Wernicke's speech area by the arcuate fasciculus. Here in this diagram, this is Wernicke's speech area, and both are connected with the bundle of fibers that are called arcuate fasciculus. Now here is the applied anatomy. Broca aphasia. This Broca aphasia results when there is a lesion in the Broca speech area, and the other names of this Broca aphasia are motor aphasia, expressive aphasia, non-fluent, or anterior aphasia. And in this case, the patient presents with problems to speak. He speaks slowly, non-fluent, and with effort. However, they have good comprehension of spoken and written language. And this type of lesion is also accompanied with contralateral weakness of the lower face and arm, and a sympathetic apraxia of the left hand. The inability to write with the non-paralyzed hand. So the non-paralyzed side will also affect, and this is called sympathetic apraxia. Next is the Wernicke speech area, area 22. This its location is in the posterior part of the superior temporal gyrus. This is superior temporal gyrus. In the posterior part it is located, and it is connected, as we already discussed, with the Broca speech area, and these bundle of fibers are arcuate fasciculus. So Wernicke's aphasia, what is Wernicke aphasia? It results from the lesion of the dominant hemisphere. The other names: sensory aphasia, receptive aphasia, fluent, or posterior aphasia. In this case, patients have poor comprehension of speech, speak faster than normal, and have difficulty in finding the right words to express themselves. Another term is conduction aphasia. If we transect the arcuate fasciculus, then this aphasia will be result a fluent aphasia associated with poor repetition of spoken language. Speech comprehension and expression are relatively good. Now we see the sensory areas. First one is the primary somatosensory cortex, area 312 here. Area 312, this blue shade, primary somatosensory area. It is located in the post-central gyrus. This is central sulcus behind this post-central gyrus, and in the posterior part of the paracentral lobule. It receives input from the ventral posterior nucleus, and it contributes to the corticospinal tract. If we stimulate, then it will result, if we stimulate this area, then it will result in contralateral numbness and tingling sensation. And destruction of this area results in contralateral loss of tactile discrimination, that is called hypesthesia and stereognosis. Stereognosis is the loss of ability to recognize the things when we don't see and only we touch with our hands with closed eyes. We cannot recognize. This is called a stereognosis. And a loss of ability to localize sensation. Here is the classic apraxia, inability to button once closes or comb once here when asked, the inability to manipulate tools with the retention of the ability to explain their use. Then facial apraxia, this is the inability to perform facial oral movements on command. For example, if we have to lick the lips, so the most common apraxia is the facial apraxia. Here is the different movements which are asked to do. Like sensory apraxia, inability to formulate the idealization plan for executing several components of a complex multi-step action, for example, performing the steps of tying the shoes when asked to do so. And this occurs frequently in diffuse cerebral degenerating disease, Alzheimer's disease, and multi-infarct dementia. Next is the primary visual cortex, area 17. It is located in the occipital lobe. This is occipital lobe, and it is responsible for sight recognition. In the sight, we recognize the size of the things, color, light, motion, and dimension, etc. Destruction of this area results in visual field deficit, for example, contralateral monominous hemianopia. This is primary visual cortex, area 17. And then secondary tertiary visual cortices include area 18 and 19. This is area 18 and 19. This is the calcarine sulcus on both sides. First is close to the sulcus is the primary visual, and away from this is the visual association cortex, area 18 and 19 on both sides of the sulcus. And it is occupied in the occipital lobe. Lesion may result in visual hallucinations. Next is the visual association cortex, area 39. It receives input from 18 and 19, then interprets information acquired through the primary visual cortex. If we destroy this, it will result in contralateral homonymous hemianopia and lower quadrant anopia. Destruction in dominant hemisphere results in Gertzmann syndrome with the following deficit: right-left confusion, finger agnosia, that is inability to recognize, name, or select one's own and other fingers; agraphia, inability to express thoughts in writing with possible retention of the ability to copy written or printed words. Then dyscalculia, difficulty in arithmetics, the patient is not able to calculation. Next, primary auditory cortex, which is area 41 and 42. It is located in the superior temporal gyrus. Superior temporal gyrus. It receives input from the medial geniculate body, and unilateral destruction results in only partial deafness. Auditory association cortex, area 22, located in the posterior part of superior temporal gyrus. It also includes Wernicke speech area. If there is lesion in the dominant hemisphere, it will result in Wernicke sensory aphasia, as we already discussed. And if lesion in the non-dominant hemisphere, it results in sensory prosody, inability to perceive the pitch or rhythm of the speech. This is the gustatory cortex for the taste, area 43, located in the parietal operculum and parainsular cortex, receives taste input from VPM nucleus of the thalamus. These are different areas. On the medial side, it is on the lateral side of the cerebral hemisphere, and this is sensory and motor homunculus. the sensory and motor homunculi, sensory representation. This is the representation of the sensory, and this is motor representation in the pre-central gyrus. You see in the post-central gyrus, sensory. Now at the end we see the white matter, which is deeper part of the cerebral hemisphere, and it consists of myelinated nerve fibers, and which are categorized on the basis of their cores and connections into different types. First one is the association fibers. The association fibers link different cortical areas of the same hemispheres. Here in this picture we can see this one is the one cerebral hemisphere, and fibers arise, and here is start and end. They connect the different parts of the cerebral cortex with each other, but of the same hemisphere. And these are two types, short association fibers and long. The short association fibers entirely intracortical. They remain in the cortex. Some merely pass from one wall of the sulcus to the other. These are the examples of short association fibers. And here are the long association fiber. Both are present in the same cerebral hemisphere, but these are long. They are present in bundles, and further these are many types. Uncinate fasciculus. This is uncinate fasciculus. Cingulum. This is cingulum. Superior longitudinal fasciculus. This is inferior longitudinal fasciculus. These all are the long association fibers. Now we come to the commissural fibers. These are the transverse fibers. They cross midline. They come from one cerebral hemisphere and go to the other cerebral hemisphere and connect the corresponding areas of the two cerebral hemispheres. The largest commissural fiber is the corpus callosum. This is corpus callosum, which connects the two cerebral hemispheres, and this type of the fiber is the commissural fibers. Other commissural fibers are anterior commissure, posterior commissure, habenular commissure, and commissure of the fornix. They all are located in this diagram. Posterior commissure, habenular commissure. This is anterior commissure. This picture also shows different commissures, and the largest one is the corpus callosum. Now the third type is the projection fibers. Projection fibers connect cerebral cortex with lower levels in the brain. Now the fibers come out of the cerebral cortex and go to the other parts of the brain and spinal cord. And these are two further types, the corticofugal fibers and corticopital fibers. Corticofugal fibers converge from all directions to form the corona radiata. These are the different fibers. They come from all directions of the cerebral cortex, and they are converging, and they are forming a shape of, this is called corona radiata. And then these fibers, they continue with the internal capsule. These are then become internal capsule. So in this picture we can see this white matter of the cerebral hemisphere, and the type of fibers are the projection fibers. As we have seen in the previous picture, these are the projection fibers which connect different parts of the cerebral cortex with other parts of the brain and spinal cord. So corona radiata, this is internal capsule. So, thank you.